Morning, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. You must have come across people, especially women, with brown colored patches on their face. They seem like freckles, like spots forming large flat patches. This is nothing but melasma. Melasma is a very common chronic skin condition in India. According to a study conducted across 4 Indian cities, reveals that more than 80% of the population presents skin color heterogeneity on the face, irrespective of age and gender. This heterogeneity mainly results from hyperpigmented spots and melasma. Indian skin tone more prone to pigmentary disorders. It occurs mainly in women 90% and 10% of males of all ethnic and racial groups. Around 20 to 30% of 40 to 65 years old women present a facial melasma. Melasma and hyperpigmentation generally ignored as sign of aging and often misunderstood skin condition. Melasma sufferers have been misinformed about aspects of this common hyperpigmentation issue. This can lead to frustrating setback in treatment. To avoid all these hazards and to keep you informed, today we are here to know about management of melasma and hyperpigmentation from an expert. So let's connect today with our skin expert, Dr. Sathyavathi, live from Hyderabad, to make aware on management and treatment of melasma. Dr. Sathyavathi is consultant dermatologist and cosmetologist with expertise in laser and cosmetic treatments, anti-aging treatments, hair transplants, and vitiligo surgery. Doctor has done MBBS from Siddhartha Medical College, Vijayawada, and DDVL from Andhra Medical College, Visakhapatnam. As residential doctor, she has worked in Topiwala National Medical College, Nayak Hospital, Mumbai, and Lokmanya Tilak Medical College, Sion, Mumbai, for 3 years. Doctor will share with us today on management of melasma and hyperpigmentation. A very warm welcome to you, Doctor, and hope you are doing good today.
Yeah, thank you.
So, Dr. Satyavathi, today we are going to talk about the management of melasma and hyperpigmentation. Now, to start with, we would first like to understand, we would first like to know what is melasma.
Yeah, melasma is nothing but it's a hyperpigmentary disorder. But the thing is, it's like brownish discoloration or patchy pigmentation, especially over the like centrofacial pattern, like over forehead and nose, cheeks, chin, and as well as the melasma. It's usually three types. Depending on the site of the melasma, it varies. Like centrofacial melasma, like malar type of melasma, and mandibular type of melasma. So centrofacial means like over forehead, nose, upper lip, and chin. So malar melasma is nothing but over the cheeks and nose. The mandibular melasma is over the malar area. Okay, and it is like brownish discoloration and a patchy type of hyperpigmentation over the face.
Okay. So now at least we know, what is melasma, what are the various types or patterns of melasma. Now the thing is, doctor, that in India, melasma is very common, especially in women. Now we would like to understand why it happens. What are the main causes of melasma?
Yeah. So many causes are there for the melasma. Actually, the main, most of the persons will get the melasma because of sun exposure. Sun exposure is the main cause. The second thing is hormonal disturbances and like thyroid dysfunction and ovarian dysfunction. And if any history of phototoxic drugs like phenytoin and like cosmetic usage and any thyroid dysfunction, okay, and even OC pills usage. These are the main causes for the melasma.
Okay. Along with melasma, there is another term which is very popular and is again very common, and that's hyperpigmentation. Now, doctor, we would like to understand, are these two different things or they are the same?
No, the hyperpigmentation is a broad term and the melasma is particularly, it is brownish discoloration present only over the face, and that is in the centrofacial pattern. If it is hyperpigmentation present all over the body, or is like hyperpigmentation is a broad term. If like acne, if acne is there, the acne heals with the post-inflammatory hyperpigmentation. That is not the melasma actually. There are so many kinds of hyperpigmentation disorders are there. The hyperpigmentation is totally different from the melasma.
Okay, so now at least when we know that melasma and hyperpigmentation, they are
Totally
different, and
different.
melasma comes under hyperpigmentation.
Yeah.
It may comes under hyperpigmentation. We would also like to know how it starts. I mean, what are the symptoms and signs? Okay, we understand that it's, we get to see dark pigmented patches, etc. But I'm sure in the starting, it's not that big or broad. So how does it start? How to spot it as soon as possible so so that we can go and get it treated?
Actually, melasma is a totally asymptomatic. There is no pain, there is no burning sensation, there is no itching. It is totally cosmetic concern, and there is no symptoms at all. This is the cosmetic problem, and they comes like it's a pigmentation, patchy pigmentation over the face. But sometimes the extrafacial melasma will be there, like over the forearm and over the sternal area. But there is no there is no symptoms at all for the melasma.
Okay, so there is no symptom, it's asymptomatic. And you also said that it's just a cosmetic concern, So we can say in a way it's not going to affect the internal organs or anything. It's just the look that it's going to have,
Yes,
right?
yes, yeah.
Okay. We would also like to understand what are the risk factors for melasma.
The risk factors for the melasma, see, depending on if any thyroid dysfunction is there, any ovarian dysfunction is there, or any OC pills usage is there, or chronic exposure over the sun. These are the risk factors for the melasma to get this pigmentation over the face especially.
Okay. And how do you or how do doctors diagnose melasma? I mean, is it just by the appearance or clinical checkup they can say that, okay, yeah, it's melasma?
Actually, yeah, for clinical, it's there is two types of clinical diagnosis. Especially, we'll see the melasma is normally we can clinically examine the patient to see. And second thing is by wood slam. By wood slam, there is we can see the it is epidermal type of melasma or dermal type of melasma or mixed type of melasma. If it is like epidermal type, it will be like brownish discoloration. If it is like dermal type, the pigmentation will be more deeper, and it is in the dermis, deep dermis. And if it is in the epidermal pattern, the pigmentation is in suprabasal layer. So the mixed variant is like both of the epidermal and dermal variant.
Okay. And doctor, what are the treatment options for melasma?
Yeah, just
Sure.
from treatment pattern concerned, there is topical treatment is there, as well as systemic treatment is there, and as well as procedure treatment is there. So depending on the patient, if patient is having very small patch, and then we have to go for the only topical treatment. If the patient is, and depending on the patient consent also, if they want we have to clear by marriage is there or function is there or something else is there, then we have to go for the both combined treatment, topical treatment as well as procedure treatment. If there is no such kind of things, then we have to go for the topical treatment. And then so many creams are available, but the Klegman's formula is the gold standard formula for the melasma. That is fluocinolone with the tretinoin and as well as hydroquinone. Okay, but every patient will not suggest that triple combination of cream, because all the patient, they have to apply some over the counter creams and they'll come. If they are applying that kind of creams, then we have to go for the depigmenting creams without any steroid, without any tretinoin, and without any hydroquinone kind of creams, then we'll wait for 1 to 2 months, and then we'll go for the strong creams, like same triple combination type of creams. So depending on the patient, we have to suggest the treatment. And if
Fair
like
enough.
procedural kind of thing, then we have to suggest for chemical peels and as well as lasers.
Okay. Now, doctor, as you mentioned, over-the-counter creams. Now, what happens, especially with melasma or hyperpigmentation, people will first go who are having these patches or hyperpigmentation on their skin. They'll first go and try some home remedies
Yeah,
or things like that, or else they'll go to a chemist and say, "See, I'm having these patches." Most of them won't even know that there is a term called melasma.
yeah,
They'll say, "I'm getting pigmentation or hyperpigmentation." So they'll get the creams and start using it. And it's only when they find that nothing is working, then that's when they go and land up in front of the doctor, dermatologist
yeah.
in this case. Now, as you said, over-the-counter medication is not a good idea. How harmful it can be, especially in the case of melasma or
Yeah,
hyperpigmentation.
actually, over the counter creams, they'll suggest definitely steroid kind of creams, and so they applied long term of steroid, then the skin will be like more thinning, and there is like blood vessels will be, you can see in the wood lamp of this thing, and then the skin will be very sensitive. And they came with the like initially, if they apply the steroid kind of creams, they'll feel very happy. The cream is working very good, but the thing is,
Mhm.
after long-term application, they feel like it's a severe redness will be there, and they with that kind of cream, they will not apply the sunscreen, so the skin will be more pigmented, and then at that time they'll visit to dermatologist actually. So at that time, the skin will be more sensitive, and then more redness will be there, and as well as more thinning will be there, and more atrophic skin will be there.
Right. So it's always a good idea to consult a qualified dermatologist as soon as a person discovers, either pigmentation or hyperpigmentation or patches, anything, any issue with your skin, please go and consult a dermatologist and a qualified dermatologist without wasting much time, because ultimately, we end up worsening our condition, and that's when we go and land up in front of a doctor, and it becomes even difficult for them to treat it. So
Yeah,
please don't
yeah,
waste your time. Go and consult your doctor. That's really important. Another thing is, doctor, we often say that prevention is always better than cure. Now, in India, as we know that we are under the sun most of the time, or we have a really good amount of exposure to the sun. And again, melasma or hyperpigmentation is very common in India. Now, is there anything living in this condition we can do to prevent melasma or hyperpigmentation?
yeah, definitely. Actually, sunscreen is the main treatment melasma. Actually, the for melasma, there is no curable disease. It is the prevention is better than cure type of disease it is. So
Mhm.
melasma, we have to suggest the patient first is like sunscreen. The broad spectrum sunscreen is very important, like more than 30 SPF with PA triple plus. The broad spectrum sunscreen, that is also 3 hourly, 3 to 4 hourly application of sunscreens, like every day. Even in the indoors also, they have to apply the sunscreen, and depigmenting creams also they have to continue every day. And initially, like or like tablets also, like doctor suggesting that tranexamic acid kind of tablets, glutathione kind of tablets, and vitamin C and vitamin E. These are antioxidants. These are very helpful in the melasma. And like topical depigmenting creams like fusic acid, azelaic acid, and glutathione, like topical kind of creams. Also, so many creams are there, but they have to continue it. If they are stopped the creams, then the recurrence will be, the more chance of recurrence will be there for the melasma.
Oh, okay. So the most important thing is the use of sunscreen on a regular basis. So we would like to understand a little more, or we would like to talk a little more on sunscreen then. Doctor, you said that anything, 30 plus SPF is good for your skin. So please go for 30 SPF or 30 plus SPF sunscreen. Now, the thing is that many times, as you also mentioned, that people who are living inside the homes or who are working from the office or from home or have very little exposure to the sun, or especially during monsoons or winters, they'll say that I don't need a sunscreen because I'm not going out in the sun. I don't have a field work, I'm driving in a AC car and I'm reaching the office in 10 minutes. And nowadays, so many people are working from home. They don't follow any skincare routine anymore because they know they're not going out. So no exposure to the sun, no pollution, nothing. Why is still then, sunscreen is so important or essential? Please shed some more light over that. Doctor, am I audible to you? Are you there with us? I think we lost the doctor and would like to connect back to her. For the time being, let me tell you that today we are talking about the management of melasma and hyperpigmentation. Dr. Sathyavathi, yeah, can you hear me? Doctor, I can't get your voice properly.
Some disturbance is there.
Yes. I think some network issue is there. Yeah. If you can hear me, yes. We would like to understand a little more about sunscreen, Dr. Sathyavathi, if you can hear me. I think there's some technical problem. By the time doctor's back, let me tell you again that today we are talking about melasma, the management of melasma and hyperpigmentation. Now, the issue is that even if our exposure to the sun is not that much, even if we are working from our homes or from office and we are working in an air-conditioned environment, still we need to use sunscreen. And as soon as the doctor gets back to us, we'll continue our talk from there, that why sunscreen is so essential. So we often say that use sunscreen regularly, the amount of sunscreen, the SPF, the sunscreen as per your skin type, and as per your working conditions, the reapplication, they all are equally important. And yes, doctor is back with us. If you can just, turn.
Network issue is there with the laptop actually, so I joined through the mobile phone.
Okay, fair enough, no problem. If you can just, put your phone in a horizontal way, able to have a better view. Exactly. But you're also logged in from the laptop, I guess.
Yeah. Okay, fine.
Yeah. So the laptop is still open. I can see two windows right now.
Okay.
Yeah. Because otherwise it will, give a lot of disturbance and noise. So you need to close one and stick to the one which is giving you the better network.
Oh.
Okay. So we are sorted now, doctor, and we can carry forward from where we left.
Yeah.
Okay, so I wanted you to shed some more light over the usage of sunscreen and how to apply it, how much amount to take, because as you said, it's very important to apply sunscreen regularly and in the right way. So what's the right way, doctor?
Yeah. Actually, this we have to choose broad spectrum of sunscreen. That is first thing. The second thing is the quantity of sunscreen is very important. Is that we have to take this much of amount, like fingertip unit of sunscreen. Then that is the fingertip unit is for the face, total face as well as neck. If we'll take this much of quantity, that is there is no protection for that. And the sunscreen we have to apply like 3 to 4 hours repeat application will be there. That is very important. If we'll apply one time of sunscreen, then there is no protection from the UV rays, like especially the sunscreen will be protection like UVA, UVB, and as well as infrared radiation sunscreen we have to choose. that is very important is that like PA triple plus is very important. We have to see is it like PA triple plus is there in the sun protection factor or not, because the sunscreen the sunscreen is very important in the melasma to prevent the melasma actually. So the fingertip unit of sunscreen is very important for to apply the sunscreen.
Right. So regular application, repeat application or reapplication, right quantity, right kind of sunscreen as per your skin type and your working condition, they all, collectively actually helps in preventing our skin from the harmful rays emitted by the sun or other
And the
sources of
quantity of
light.
sunscreen is also very important. The
Exactly.
quantity, yeah.
So, peanut-sized sunscreen is not going to work. It's of no use. So don't waste your sunscreen by applying a little bit of it on your face. It is actually a jacket. So you need to, cover your face or whatever
Yeah.
area of your body is exposed so that it can evenly cover your body part. Now, doctor, there are some misinformation about melasma and hyperpigmentation also. Please
Yeah,
enlighten us about them
actually,
as well.
see, melasma is nothing but like we can say cloasma. Also, in pregnancy, if like melasma is there, we have to tell that cloasma. That is nothing but melasma in the pregnancy. The
Okay.
melasma is like patchy hyperpigmentation or brownish discoloration present, especially over the face, over the forehead, nose, chin, and as well as cheeks and as well as mandibular area. That is the facial melasma. The extra facial melasma is nothing but it present over the sternal area, over the forearm and as well as arm area. And the main risk factors for the melasma is the especially sun exposure and as well as OC pills usage, and any ovarian dysfunction is there, or any cytotoxic drugs usage like phenytoin or phototoxic drugs. If any patients are using like phototoxic drugs and phenytoin and as well as doxycycline and minocycline, that can cause the hyperpigmentation over the face. Then we have to take the history if patients are using anything that any such kind of drugs before, and that is very important. And the hyperpigmentation is a broad term. The hyperpigmentation, the like any moles are there, like or the freckle or the face, if freckles are there or dupions are there, then that we have to know like the that is like more pigmented, and that is melasma is brownish discoloration. The hyperpigmentation is totally different than melasma.
Okay. And doctor, can melasma turns into cancer, skin cancer?
No, not at all. Because see, melasma is usually common in the skin type of the 3, 4, and 5 and 6 skin type. And actually, there is no such reports till now are presented for the melasma to change to skin cancer actually.
Okay. And can melasma be hereditary? Like if any of the parent are, do have melasma, then are there chances that their children will also have melasma?
Actually, familial history is there actually for the melasma. Family history is there. Genetic predisposition is there actually commonly for the melasma, but not for everyone. If the family history is there and then the patient are exposing to sun exposure more, then there is chances of melasma is there.
Right. And is melasma due to some allergy or infection?
Actually, there is no such allergy, or actually the melasma is not allergic condition and it's not a infectious condition actually. It is because
Mhm.
of sun exposure, and it is because of what you said, like familial predisposition, and as well as because of ovarian dysfunction, and as well as actually thyroid dysfunction. Like patients are having hypothyroidism, then the kind of chance of getting melasma is more in hypopigmentation. Hypothyroidism.
Mhm.
Hypothyroidism patients are getting melasma more comparatively in like normal individuals.
Right. Doctor, one very important question. Is melasma permanently cured? Can it be permanently cured?
Melasma, see, I told you like it's a preventable disease. There is no cure for the melasma. Actually, we can prevent the melasma, but there is no cure for the melasma actually.
Mhm. But it's preventable, and also as soon as you discover that you are having melasma or anything close to it, if we go and consult a doctor, at least we can restrict it
Yeah, definitely.
there itself. So it will stop from spreading. We can stop it from spreading all over the face, etc. So that's
Yeah.
why it's important to consult a doctor before wasting your time in doing home remedies or over-the-counter treatment or self-medication, or asking a friend or family member that what they did with their skin condition. Every skin is different. Every person is different. So it's always good to consult a dermatologist in case you have these dark patches on your face. We'll also take some of our viewers' questions, and Sahil Nigam just asked what we just discussed. Is melasma permanent? So I think we have already discussed it. It's not completely curable, so it's always good to go and consult your doctor. Sakshi Jha is asking, though we have again discussed it, but still, why do women get melasma when they are pregnant?
Yeah, because as I already told you, like the melasma, the pregnancy condition is a hormonal disturbance will be there in the pregnancy. It's a hormonal condition. So definitely in melasma is like I told you, the cause of melasma is also like hormonal dysfunction is the reason for the melasma. So definitely in pregnancy, not all pregnant women will get the melasma, but few of members will get the melasma in pregnancy. That is also known as plasma.
Okay. Sonia Singh is asking, are there any natural remedies to combat melasma?
Then, yeah, definitely. See, like nutrition, diet is very important in melasma. As definitely we have to take like vitamin A, E, and as well as antioxidants and green leaf vegetables, carrots, and these all are rich of antioxidants. Then they definitely will help you in the a natural this thing in melasma. It acts as an antioxidant in melasma.
Mm-hmm. So it's important to eat well, right?
Yeah, definitely.
Mm-hmm. So eating well, eating right is really important. So eat whatever natural things you are getting, the natural way of intaking vitamins, minerals, nutrition. It's really good. Preetham Iyer is asking, are there limitations to treatment strategies in melasma?
Yeah, definitely. Treatment limitations means depending on the patient, we have to choose the treatment. Like the patient is having only like brownish discoloration is present, we have to prescribe them only topical treatment. As I said, like the topical, so many kind of creams are there. And as well as definitely we have to prescribe sunscreen for everyone. And as well as topical treatment as well as procedure treatment. And the topical treatment, as already I told you, like triple combination creams are there, as well as depigmentation creams are there, and like systemic treatments also there, like oral glutathione, oral tranexamic acid is much useful in melasma actually.
Right. Romeo Lincoln is here asking, can melasma spread over other body parts or areas of the body?
Yeah. Actually, as I look, actually, extrafacial melasma is also there. I told you, like it's melasma is it comes over the sternal area also, as well as over the forearm, as well as the arm area, as well as for few patients it get over the back side also. So the extrafacial melasma is also there. So it comes definitely like facial as well as extrafacial. It's also there.
Okay. Tarun Pandey is asking, how can I treat melasma the easy way? What is the easy way? Is there an easy way, doctor?
Easy way means like nutrition is very important. Like what she's taking, diet is very important for her, and as well as the sunscreen is more important. The diet and sunscreen as well as the creams, like topical creams, is very important for her to maintain her skin.
Right. And in case you have melasma or pigmentation, hyperpigmentation, any patches, it's equally important to visit the doctor as soon as possible. So don't
Definitely.
waste time is the bottom line. So in case you need the easy way, please go and consult an expert without wasting time. That's the easiest way. And yeah, as doctor is saying, eating well is really important. Vitamins, micronutrients, macronutrients, antioxidants, they do help. Priya Sharma is here. Who is at risk of melasma?
Yeah, actually, the melasma is more common in females. It's like 9:1 ratio. Not even males also, melasma will be there, but the kind is the females are more common. For females, because of hormonal dysfunction and this thyroid dysfunction, pregnancy, and as well as sun exposure, all are the causes for the melasma. But females are more common than males.
Okay, so female are more prone to melasma. Shri Verma is here asking, ma'am, can melasma be cured by using moisturizer and sunscreen?
With the sun moisturizer and sunscreen, they have to use like depigmenting creams for the melasma, and as well as systemic agents also they have to use depending on the severity of the melasma. Actually, we have to plan depending on the severity. We have to choose the massive score of the melasma. If the massive score of melasma is more, then they have to go for the systemic treatment as well as procedure treatment, and as well as topical treatment also. With the only sunscreen, they can maintain it, but there is no like it's like full melasma will be not fed, but it's little bit better than the no, nothing applying the this thing.
Right. But I think what you said in the beginning, that prevention is what we can do, what is
Yeah.
in our hand. And if we can prevent our skin from having melasma, nothing like that, because we anyways know that we are prone or we are at risk of having melasma. So doctor, again, I mean, for example, I don't have any patches in my skin. I'm not seeing any melasma or hyperpigmentation issues right now. But can I follow a very simple, which is, practically possible skincare routine to prevent it forever? So sunscreen definitely you said is important, but again, a very simple skincare routine that everyone can follow. Would you like to tell about that?
Yeah, definitely. Actually, everyone like routine every day, like we have to cleanse our face and we have to apply the moisturizer. And over the moisturizer, we have to apply the sunscreen. The sunscreen is not protect from the sun rays, but it protect the sun rays as well as anti-aging also. Like it will decreases the wrinkles over the face, as well as it anti-aging kind of property is there for the sunscreens. And so we have to continue the moisturizer, sunscreen, as well as cleanse the face, and we have to take antioxidants like vitamin C, vitamin E, and vitamin C is more important to maintain our skin.
Right. So a healthy way of living is really
Yeah.
important. It's important to eat right, and it's important to sleep well or have a good healthy lifestyle. And also, it's important to have a very simple but a regular skincare routine comprising of cleaning your skin and moisturizing it regularly. Sunscreen again is very important. Now the thing is, doctor, that continuously we are emphasizing the use of sunscreen, because that's one big tool that we have to prevent melasma or hyperpigmentation problem. Now, the thing is that despite knowing everything, still 67% of Indian population is not using sunscreen as a daily care routine, skin care routine. Now, what you would like to, tell them that why it's important to include it in your regular skincare routine?
See, yeah, as I already told you, like sunscreen is very important. The patients think that I'm in indoors only, why I have to apply the sunscreen. But the see UV rays, it pass through the clouds, it pass through the windows and this thing. So we have to apply the sunscreen even in the indoors, as well as we are going the outside, and as well as like if the patients are going like swimming and this thing, they have to apply the sunscreen like water resistant kind of sunscreen they have to choose, and the water resistant kind of sunscreen also they have to repeat it like with every half an hour only, because the water resistant sunscreens are not there like 3-4 hourly. If they repeat it, then there is no protection for that. So they have to repeat it like every half an hourly if they are in the like water only. And actually sunscreen, it's very important in melasma to prevention and as well as cure for the melasma.
Right. Rohit Sen is asking that, ma'am, is melasma dangerous? Can it be dangerous for us?
No, definitely it's not dangerous disease, melasma. Actually, it is a cosmetic concern. And if there is, if they are not using any sunscreen, if they are not applying any creams, or if they're not taking the treatment, then melasma will be the face will be more darker and it will spread total face. Actually, it comes only over the forehead and chin, nose, and cheeks there. Like if they are not using, then the total face will be more hyperpigmented and then it is more of cosmetic concern. Actually, it's not a dangerous disease.
So it's not life-threatening, no way, but yeah, it do affect the appearance, and that's why people are concerned, and that's why we are trying to tell here that CA it's preventable. You can use sunscreen and eat well, etc. B, in case you have it, please go and consult your dermatologist as soon as possible so that you can restrict it. Because we all know that even if it's not life-threatening, but then your appearance, plays an important role, not for others, but about yourself, because many times it do affects our self-esteem or confidence. So if you're okay with that, then it's fine. But otherwise, if you're concerned about the cosmetological, aspect or how you look or appear, then yeah, please try to prevent it. And yeah, prevention is possible. Now, doctor, we would also like to understand now when a patient comes to you who has already wasted a lot of time in doing home remedies or waiting and wishing that it will just go away on its own, or doing over-the-counter treatments, etc., and finally comes to you saying that I have already wasted a lot of time, money, energy, etc. What's your first reaction? I mean, do you tell them that if you could have you would have come early, then by this time maybe we could have done something good, and now it's really difficult, or things like that? I mean, because I'm sure people land up to the doctor at the very very very
Yeah.
last time.
Actually, if such kind of patients comes, then I'll take proper history from them, like what kind of creams they used before, and then we have to counseling is very important for such kind of patients, and then depending on that we have to decide the treatment, and for them actually will not give us like any strong kind of creams, and for that patients we have to go for the procedure is very important. For that kind of patients, I have to go for the chemical peels. The chemical peels is also like not in one sitting. There is no result for the one sitting for the chemical peel. The chemical peel is nothing but like it's a like it extracts from the fruits. Actually, it's not a chemical. It extracts from the fruits. So we have to use a higher concentration of chemical over the face, like depending on the patient bearing capacity, we have to keep over the face like 10 minutes or 20 minutes, depending on the what kind of peel we are using. So depending on that, we have to dilute it, and then after that we have to explain the patient like after 2 to 3 days the skin will peel up, and then after that like the newer skin will come, but they have to apply the moisturizer and as well as sunscreen. The sunscreen is very important after the peel also. If they are not apply the sunscreen, then the after peel the skin will more sensitive and UV rays pass easily. Then the again pigmentation chances will be there. So for them, we have to suggest that they have to apply the sunscreen. The is very important after the peel also. And the peel is like once in 15 days. That depends on the result of the patient. We have to decide like how many sessions will be take for the this kind of melasma. Definitely we have to go for the 6 sittings or 10 sittings depending on the like pigmentation like melasma, how it is responding. For every sitting, we have to decide. Yeah.
Right. And doctor, as we are, moving towards the conclusion part of this session, any takeaway message
Yeah,
for our viewers
definitely
before
for
we
the
wind up?
melasma, the sunscreen is more important for the melasma to prevent prevent. And there is and we have to take healthy diet, like nutrition is very important, like vitamin A, E, and as well as vitamin C is very important. Vitamin C we can take long term also, and as well as green leaf vegetables is very important. And you cleanse the face with mild cleansers, and then use moisturizer, and then over the moisturizers we have to apply the sunscreen. The sunscreen is more important for the melasma.
Right. It was wonderful talking to you, doctor, and I'm sure it was a very informative session, and viewers will really, have learned a lot from this conversation. Thank you so very much for joining us and sharing your valuable time with us.
Yeah, thank you.
And viewers, thank you for your active participation. Stay beautiful. We are all working towards freedom from skin pigmentation. So stay connected to beautiful spotless skin page. Thank you. Goodbye. Have a good day. Goodbye.